So the EPA was involved in a major way, and the very first study that came out was in 1979, and it looked at the prevalence of asbestos in American water, and it found there was a significant amount of asbestos in water. But the second and more important thing that the EPA wanted to know was, is it harmful to ingest asbestos? And you'll see here in the 1980 study that the passage of ingested fibers through the human gastrointestinal mucosa, in other words, it passes through the gastrointestinal tract. And that was one of the first and most important things that they had to learn. Now, this is, keep in mind, this is an early study in 1980, but the US EPA said that, yes, indeed, we have something to look at here because it's likely to be a human carcinogen when ingested. Now, it's interesting. I just recently came across a study from the UK. Keep in mind, this is EPA 1980. This is the BT Commons report out of the UK in 1983, and it came to a very different conclusion. And I just want to read that. A great deal of time and money has been spent in the last 10 years or so evaluating the subject, and now it would seem that the controversy has, for all practical purposes, ended, and maybe the issue can be regarded as essentially a non-problem. Perhaps research effort should be now sensibly diverted into various other environmental issues. Well, it's interesting because the EPA had a very different take on this, and here is the study from 1985. And as you can see there in the red highlights, that the EPA had some very, very serious concerns about the ingestion of asbestos. But it wasn't until the Department of Health and Human Services got its hands on the EPA studies that it really became a bigger concern. And the Department of Health and Human Services is the big dog in American healthcare. It's currently being run by Robert F. Kennedy, Jr. And as you can see from that 1987 study, that they were very concerned. And to be fair, this is the conclusion of that study, and it starts off in a very soft manner, saying that the ingestion of asbestos is not the most important issue facing America in 1987. But by the time it gets down to this bit, it talks about millions of people getting a substantial number of cancers over their lifetimes because of the ingestion of asbestos. And the panel recommended eliminating possible sources of exposure to asbestos whenever and to whatever extent possible. Followed up a few sentences later by saying, get rid of the pipe in water supply systems and reduce the levels of asbestos in water. And that was in 1987. Well,